In 2003, the Government of Ontario created 14 regions within the healthcare system. These local health integration networks are public agencies that plan, integrate, and fund local health services within the region. Each LHIN is responsible for hundreds of millions of dollars in healthcare spending. LHINs were created because a community's health needs can be met more effectively by a local administration than by a centralized ministry. The Southeast LHIN region is home to just under 500,000 residents and is responsible for a budget of about $900 million per year. Earlier this year, the LHIN began preparations to issue a new 3-year funding plan called an Integrated Health Services Plan. As it prepares to release its first draft this summer, the LHIN is actively listening to what health service providers and members of the public have to say. This process began in late January. During a 2-day meeting, the LHIN met with more than 150 health services providers from across the region. The LHIN then convened a special Citizens Reference Panel to learn about the health needs of the region and provide advice.
It's a privilege to be one of the people who was chosen. It means a lot to me to be able to have this input and to just see how the whole system functions. So I'm rather happy that I got the chance to do that.
To create the Citizens Reference Panel, the LHIN sent out 5,000 letters to randomly selected households, asking residents to volunteer to spend 3 Saturdays in February and March participating on the panel. Out of a group of 220 respondents, we randomly selected 36 panelists who would represent their communities and reflect the age, gender, and geographic profile of the region. Each of these 36 panelists represented approximately 13,000 Southeast residents. Over the next 6 weeks, the panelists completed a 3-stage process. First, the citizens heard from a range of experts. This learning phase was designed to give the panelists the information they needed to make a more informed contribution to the discussion and hear several different perspectives about healthcare. On our first day together, Paul Harris, CEO of the Southeast LHIN, spoke about the role of the LHIN in the Southeast and how its $900 million budget is spent.
LHINs allow the largest bureaucracy in Canada to be more responsive or nimble. So today, 2009, Ontario spends $40 billion on healthcare for 13 million people.
Members of the LHIN team spoke about the demographics, health status, and geography of the region and gave them a sense of the issues the LHIN will face in the near future.
So I put those up because this is the best map I've seen that ties the duality of need versus numbers, and questions of access immediately jump out.
The citizens also heard from the CEO of the region's largest hospital, Kingston General. Leslie Thompson talked about her desire to see the Southeast become a living lab for healthcare innovation. She also shared her insider's view on the day-to-day challenges of running a major hospital.
It is about creating value. And so the questions from that are, how do we design a healthcare system that dramatically improves value?
I'm learning a lot. I mean, I don't know a lot about the healthcare system except that you have to wait a long time to get into an emergency. But it's really interesting. I'm learning a lot. I'm glad that I got selected for this committee. It's really an interesting process.
It is a very good opportunity to teach the public because I transferred many ideas from here to my customers, to my friends, to my family members. And meanwhile, I transferred backwards from my customers and my family members and my friends to the LHIN as well.
Having completed the learning program, the panelists then prepared for a citizens' town hall, where the general public would have a chance to join the discussion. The event began with a talk by CBC Radio's Dr. Brian Goldman, the host of the medical program White Coat, Black Art.
I was amazed at the amazing things that my colleagues would say in the hallways of the hospital and in doctors' lounges and nurses' lounges that they wouldn't be caught dead saying to the public.
Following his presentation, panelists and audience members worked together at round tables to complete 3 tasks and share their views on the health system.
Really appreciate your feedback because LHINs are new, this kind of process is new, and we're trying to figure out what works, and we'll only learn if you help us. We'll welcome any feedback, any questions on your way out. I want to thank you very much all for giving your time and energy to this afternoon session. Thanks very much and have a great afternoon.
The healthcare system seems to be a lot better organized than what I believed to be before.
This process has been fantastic. I am really, really excited to be a part of this. Probably the most significant thing that I will come away with this is more hope. I didn't think Kingston was ready for this. I am thrilled at the reception that I'm receiving professionally, but also individually. The Southeast LHIN is very interested in what citizens have to say. It's a new process, and everyone is taking it so seriously, and everyone is full of such great ideas, and we can really feel the progression after just 3 Saturdays. There is a lot of hope that Kingston is going to feel these tiny changes that can only be better.
In the final advisory phase, the panel produced a series of recommendations for the LHIN that will help inform the next 3-year action plan for healthcare in our region. Following a long process that required the panelists to sort and synthesize dozens of different ideas and suggestions, the panel reached 6 overarching themes. These included increased collaboration among healthcare service providers, addressing community-specific health issues, more proactive leadership on the part of the LHIN, and seamless access to care that is appropriate and respectful to the individual patient. As well, the panel recommended bolstering primary care services and strengthening community support systems. Armed with this advice and many more detailed ideas from the panel, the Southeast LHIN is now touring the region. At a series of open houses, the LHIN is inviting members of the public to join this conversation about the health system needs of the region. Your input, your views, and your experience with the health system will go a long way to help us create the next Integrated Health Services Plan. To find out more about the Southeast Local Health Integration Network and the next Integrated Health Services Plan, please visit our website, southeastlhin.on.ca.